afternoon, everybody. My name is Leslie Ann Johnson. Welcome to this afternoon's press conference. We do apologize for the late start. There were some things that were beyond our control. Nevertheless, we are here and we're happy to have you with us. Those of you joining us on Channel 22 on the Facebook page, and of course, those of you in the diaspora and our media colleagues, as well as for those in the room as well. Good afternoon to you. As I mentioned, my name is Leslie Ann Johnson, and this is a press conference by the Ministry of Health. We have with us here the Acting Chief Medical Officer, Dr. Sean Charles. He is further away from me, and Dr. Bert Braffett, the chairperson of the Health COVID Committee. We're hoping to have Dr. George Mitchell, the former COVID-19 coordinator, via Zoom. Without any further ado, we'll start off today's proceedings, and I'll go to Dr. Sean Charles.
Good afternoon, everyone. Now, I realize it's been some time since we've had one of these briefings, so it would be helpful to at least start by giving an update as to the status of COVID-19 and the status of our response so far. So, as we are all aware, the first case of COVID-19 was reported around March 22nd, 2020. And to date, Grenada has recorded 24 confirmed cases. 11 of those were male and 13 female. The ages range from under 10 to over 70 years of age. A number of these cases initially were associated with travel from the UK, then we had from the US, and we had a small cluster of infections locally as well that has since resolved. Our last reported case entered Grenada on 22nd of July 2020, and this individual has since recovered. So in a nutshell, we've had 24 confirmed cases identified. Out of those 24, we've had 5 persons hospitalized, and all of those persons were treated and discharged and recovered. We have at present no known active cases, but the work continues, surveillance continues, education continues. To date, we have done in excess of 1,600 plus PCR tests, and this is something that is ongoing, and on a weekly basis now we do in excess of 100 PCR tests. Like I say, surveillance continues. We have had some gains in our capacity to address COVID here locally. Significantly enough, we now have the capacity to conduct PCR testing at our General Hospital lab. So the bulk of the testing that is being done now is conducted by Ministry of Health. We also still collaborate with SU, and we continue to rely on the testing service, particularly when we receive surges in the number of cases that needs testing in short order. And we are thankful for the continued assistance in this area. We have also increased our capacity to identify contacts of cases should the need arise going forward. So we have a number of groups of individuals distributed throughout Grenada that have received training to conduct contact tracing, and should the need arise, we will activate these groups in order to assist us. We continue to work on strengthening our protocols at ports of entry, because we are doing a lot of work to avoid the importation of cases, because as you are aware, we have started the phased reopening of our borders. We started with regional flights, and we have recently started receiving flights from Canada. In fact, as we speak, a flight from Canada is being processed at present. All right, we are constantly looking at our protocols and seeing ways in which we can adjust, because as we are aware, the COVID situation is dynamic. We are seeing how things are changing both near and far, all right, in further regions, more developed regions, and even in our local region, we're seeing some of our neighbors having small setbacks, and we are hoping that there remain small setbacks in their efforts to respond to COVID. And we are looking at what is happening there and adjusting our protocols so that we do not enter into a situation, into a similar situation. Now, there have been quite a number of questions with regards to the protocols for entering Grenada, because remember what I mentioned earlier is that we are constantly looking at ways to strengthen our protocols for persons entering Grenada. All right, and there have been quite a number of questions with regards to this same process of entry into Grenada. There are ongoing discussions in that line, and we have recently updated our draft protocols for entry, and some of which we would like to explain during this activity. So we have divided countries into risk zones or risk categories based on the level of infection that is ongoing there. All right. Countries that are considered to have a low risk are those where the number of infections within the past 14 days are less than 20 per 100,000. In the medium risk, we have between 20 and 90, I believe. Yeah, and the higher risk is above. All right, is above that. Right. So for countries that are in the low risk category, all right, all persons are required to have a negative PCR test to enter the state of Grenada, and that test should be done no more than 7 days before. But there's a small grouping that is exempt from this, all right, and that is what we call the bubble. And these would include countries like Barbados and Dominica and St. Kitts, Nevis, St. Lucia, St. Vincent. They are currently exempt from this requirement. All right, they are requested to fill a number of forms, such as health declaration, waiver of liability, and public health locator forms. All right, and in the event that a public health official, on screening that person at port of entry, determines that that person needs further testing, that person would have a PCR test done, and they'll be required to stay in quarantine until we get the result. All right. Generally, between 48 hours, those results should back. All right. So if someone presents and they have a high temperature, or they have other respiratory symptoms, the public health official at ports of entry require that person to have a PCR test. So for persons in the medium risk zone, all of these persons once again are required to have a negative PCR test done within 7 days of travel. So the PCR test should not be older than 7 days. They're required to fill the forms. Once again, upon arrival, this group will have another PCR test done. The swab will be collected on entry at the airport. All right. These individuals will be required to observe a 10-day quarantine. However, they're required to do at minimum the first 48 hours in a state-approved quarantine facility pending the result of the test. All right, so when they enter, a swab will be taken to conduct a PCR test. During the first 48 hours, they will stay in a state-approved quarantine facility. All right, at minimum 48 hours pending the results of the test. All right, if the test is negative, they'll be given the option of spending the additional 8 days. So let's say it's at the 48 hour and they get a negative result, they'll be given the option to spend the remaining 8 days at their homes. But they will have to agree to wear the geofencing watch. All right, so for the persons who are going home to quarantine, they will wear the geofencing watch, which is a watch that will be placed on their wrist. For those who do not wish to wear the geofencing watch, they can spend the remainder of the time at the state-approved quarantine facility. For those who are positive, of course, that person has to remain in quarantine, and of course they will be reassessed by health officials to secure their release once they have cleared the infection. For persons coming from high risk zones, these persons once again must have the PCR test done. They must fill the required forms, and they as well will have a PCR test sample taken for testing upon entry into Grenada. These persons are required to observe a 14-day quarantine. All right, they're required to spend 14 days in quarantine. And that is quarantine at a government-approved facility. All right, at a state-approved facility. Now, these individuals will spend a minimum of 10 days at this facility. All right. That is whether the result is positive or negative. They are required to spend a minimum of 10 days at this facility before the option of continuing quarantine at home can be offered. All right, and the individuals that will be allowed home are those whose PCR tests are negative, and that is after 10 days. All right, now the individuals that are allowed to go home at 10 days to continue the remaining 4 days at home, they'll be required to wear the geofencing watch. All right, if the individual does not wish to wear the watch, they can remain in the quarantine for the full 14 days. And of course, if the PCR is positive, then the individual will remain in quarantine until he or she is medically cleared, all right, with a negative PCR result. So that in a nutshell is the entry protocols. And we hope that it doesn't create any confusion and persons are able to identify what the steps that they will be required to follow are. Now, another thing that must be mentioned is that we do observe that there are individuals that, for different reasons, are not in agreement with being quarantined, and there are individuals that are finding ways to evade quarantine. And of course, we are continuing to insist on these measures because they are designed to protect the public in general. And we continue to pursue the required actions against the individuals who insist on evading these public health preventive measures. I think I should pause here and hand over to Dr. Brathwaite.
Yes. Thank you, Dr. Charles. Dr. Brathwaite, over to you.
Okay. Good afternoon to viewers and listeners. I think Dr. Charles has taken us through the full realm of what is where we are at present. I would just perhaps like to add a few additional things, and that is one of the issues that has arisen is of people coming in, obviously, and agreeing to be home quarantined and then violating that. And so we were hoping to have an app that would have allowed us to track people. That work is still ongoing in that with that process, but we met some hitches in terms of rights and with Google and other entities, and that has delayed it. Fortunately, we had the watches here, a few watches here on island, and so we decided to start to use these immediately to try to bring home to folk the importance of restricting themselves, because when they put on these watches, the location will be known, and if they go outside of the boundary of the geofence watch, it will trigger an alarm, and the health authorities will be notified, and they will obviously be questioned as to the reasons for them leaving that zone. And this is what the watch looks like. So if you see anyone wearing this watch outside, of course the other watches are going to look somewhat like this, and not every model of the geofencing. This is the present watch that is going to be worn by individuals. If you see individuals with these watches outside, keep a distance away from them, because they may well be supposed to be under quarantine. Once the quarantine period is over, obviously the watch will be taken off the individuals. So the question of quarantining is of paramount importance, because we recognize how dangerous, potentially dangerous this virus is, and we have to aim to reduce any risk of transmission. Now, as Dr. Charles said, we would have already have checked individuals and made sure that they would have had, by the time they leave the facilities, the state-approved facilities, they would have had 2 negative PCRs. One they would have come in with, and a second one that would have been done locally. But notwithstanding that, we are still taking any chances, and these individuals have to be quarantined because they could have picked up a virus in the interim. That is just before coming in, a few days before coming in, and it not show up. So we keep these individuals under quarantine until that period is over and they have no symptoms, then they'll be free to go in the community. No one likes having to do that to people. You know how difficult it is. You have to travel. It's probably twice as difficult now traveling. And then when you get home, you have to be quarantined. We know it's tough, but we have to have the interests of the broader community at stake and ensure, as far as is humanly possible, that these individuals do not go and intermingle with the community. Because what has happened in some the odd instances that when they've broken quarantine, they're not just broken quarantine, but they've gone in settings where there are crowds of people. And that's the worst scenario that you could have possible. So we are doing our level best to try to limit this from happening. One of the things Dr. talked about was the question of surveillance. And with the recent activities, with the heavy, well, not heavy in the traditional terms, but heavy relative to the present state of affairs, of activities around Carnival, when we had scores of people in some jab bands. We have to be acutely on guard for any transmission. And let me say this virus is very insidious. You saw how New Zealand closed down their country, and then they got rid of, they considered it as one of the countries that is a model country in the management of the virus. And just out of nowhere, they found a family, I think it was nearly a week ago, with 5 cases, and I think they found a few more now as a result. So even in those type situations, you can still find some circulation of the virus. And certainly, if you're having mass activities where people are closely intermingling, that is a recipe for spread of the virus. And what we will appeal to individuals not to do is to go and even have private parties, because people can hide away and have private parties and in closed quarters, and that actually has caused death of a number of people in the United States. I remember early in the epidemic where quite a few Grenadians died after having going to a party in New York. It was reported. So it's tough, but we have to be prepared not to engage in physical contact. And the wearing of masks. The wearing of masks is another very important issue. To me, the two most important things for us to do is to continue the physical distancing and to continue wearing masks. And wearing masks not just when we are outdoors, but even if you are indoors and in the workplace. In the workplace, in an air-conditioned environment, again, there can be some risk of the virus spreading if someone is carrying it. And we have to recognize that many individuals carry the virus and have no symptoms, and they can spread it to quite unknowingly to individuals. And that is why there was an appeal before the carnival activities, or the carnival-like activities, I will call them, to people not to participate in that. And hopefully we haven't had any spread. Dr. Charles and the public health team, they are going to be increasing their surveillance, that is checking more. And we should tell folk, if you have participated in a ban and you start to feel in any way unwell, please report it immediately. Please report immediately to the public health officials, because you will need to be tested and to ensure that it's not the virus that you may have acquired. And you should do that early. The slightest feeling of being unwell, especially if it's associated with the classic fever, it's a fever, cough. But even without that, just feeling unwell, feeling it just aches and pains, because this virus presents a myriad of ways. Many ways it presents. So just a word of caution to the members of the public. who would have participated, especially in those activities.
Yeah. So with regards to the risk categories that I was mentioning earlier, so a country in the low risk is one that has less than 20 cases per 100,000, the medium risk 20 to 59, and the high risk 60 per 100,000 and above. Right, and these are the risk categories. Now, when persons arrive, obviously public health officials will look at the number of case notifications that were reported for that country that they are originating from, and that is the method that will be used to assign persons to the different risk categories. To echo what Dr. Brathwaite just spoke of, we did unfortunately observe that there was a setting aside of the prevention advice and the public health measures over the previous weeks. It is quite unfortunate because it puts us in a position where we are anxiously anticipating what is to come next. We are all quite aware that 2 weeks after Carnival, there's usually a strain of a respiratory illness that usually circulates. We know that the predominant respiratory infection that is circulating now is COVID. So right now we are waiting in anticipation to see what will result of all of that activity that occurred over the past week and a half or so. We are hopeful. We are hopeful that we are hoping that we do not suffer setback as is being experienced in the south. We saw the measures that are being implemented as of today in Trinidad. Trinidad is our neighbor, and we are just hoping for the best. But at the same time, we are asking the public to be responsible in the decisions that they make, because it doesn't just affect you. It might affect one of your loved ones. All right. Persons need to understand that sometimes the decision that you take can have far-reaching consequences. We cannot change the past. Now, moving forward, we can only implore, we could only ask persons to try and do better. All right. Sometimes it feels as if persons like myself in public health, we are literally fighting persons to protect themselves. It shouldn't have to feel that way, but that is the impression that you sometimes get. And all we're asking persons is just cooperate and cooperate with us in assisting in protecting you. All right. Public health is about the good of the majority. All right, and we just continue to ask for their cooperation. All of the measures that were recommended at the height of COVID, when we had cases here, the physical distancing, avoiding crowded settings, avoiding close contacts, avoiding confined spaces, wearing of masks, hand hygiene, respiratory hygiene. We are asking everyone once again to return to all of these measures. All right. Almost on a daily basis, we hear persons commenting that in this, in one setting and the other, they are seeing that these measures are simply no longer being exercised. All we can do is ask. All we can do is try and educate. We're really hoping that we don't get to see the side of COVID that has presented in so many places, but not here.
One of the things I would like to draw attention to as a follow-up to what Dr. George has said is to point out that this virus is not just like normal flu virus that will just kill a few people. Everybody knows it is killing many more people than the flu virus. But in addition to that, they've now opened centers in some places to look after people. It's almost become a chronic illness. And so some individuals who get this virus finish up having, well, we don't know how long chronic will be, but for now, for sure, for 4 or 6 months of illness with heart problems, especially that is, we expect the respiratory problems, but the heart problems they have to contend with. They have to contend with problems related to the nervous system in terms of things like strokes, fits, and you just have to listen to any of the networks and you hear the reports. I remember this was like a month ago, and one popular journalist who had it, he described having COVID as like a tornado with a long, long tail. So i.e., you're blasted at first, a sense with symptoms perhaps 10 times as severe from talking to a few people I know who have had it as Chick V, much more, and we know how sick Chick V made us, and then, but prolonged after effects. So even for young people, the majority of whom will recover from it and go on to do well, 1 or 2 are going to be affected long term. There have been deaths in the children all through the globe. So this virus, I've been in the medical field for a few decades, well, and I've never seen a bug behave like this. So we just have to be prepared to recognize that. But we have to consider that at any time the virus can be around, because we also know that it is spread almost certainly to some extent by aerosolization, which means the particles can remain in an area for a while. So you may have gone into an area where someone was just sitting for a while, you inhale those particles, and that's how you get it, because quite often people don't know where they've got the virus from. And in some instances, in some settings, individuals get it, and you find an entire family, husband, wife, you hear that quite often. 2, 3 members of the same family, not just getting it, but getting it and dying. And we don't have anything here that is going to make us any different. We were lucky on the first rung. We have more rungs to fight, and we need to keep our vigilance up, and as Dr. Charles said, just think about what is happening and act accordingly. I hear all types of stories being promoted about masks and what masks will do and making you ill. There's no scientific evidence to show. Doctors have worn masks for years. It was doing the surgical operations. I never heard of any of them coming down and dying prematurely from wearing the mask. So wear your mask for your physical distancing, your hygiene, and I'm not downplaying that. That is also important. But as I say, I rate the other 2 as even more important in the present context of things. And I think because generally we are a relatively clean community, but we are not used to wearing masks, whereas in the Asian communities you see people wearing masks all the time, and they're probably often because of pollution and things like that, they don't suffer. So if we have to adapt to doing it, then we have to do it if we want to keep our community safe, if we want to keep ourselves safe, if we want to keep our elderly family at home or other family members at home safe as well.
Thank you very much, Dr. Sean Charles and Dr. Braffett. So, colleagues, the floor is now open for questions. Well, I think Linda Stricker indicated first. Linda, good afternoon. Are you there?
Yes, I am here. Good afternoon to all.
Great. Go ahead.
I have a number of questions. Some I'm sure my colleagues probably have on their notes also, but I'm going to start off with at least three. The Prime Minister, in his last address, did mention of a change to an advisory body. Can either Dr. Braffett or Dr. Sean explain that new structure for us and who are the persons on it and who they represent? My other question is the risk factor. Can you say when the persons who are coming in need to have the PCR test, when they get to Grenada, they still have to conduct another test. Who is paying for that test and how much it costs? How much persons so far have skipped quarantine in Grenada? And my final question for now, are there any pending results for PCR tests and how much rapid tests has been done since the airport reopened?
Okay. In terms of the new committee, yes, government has set up a new committee. Our new committees. There's one dealing with the finance aspect. There's one dealing with education. There's one dealing with health. And there's one dealing with public relations and one dealing with material resources. I chair the one dealing with health, and we are in the process of formalizing it in the full sense of the word. But Dr. George Mitchell has been on board with us. Obviously, the Minister of Health is involved in that committee. And yesterday, we would have met Drs. Sean Charles here, Dr. Martin, myself, and the Minister would have met looking at these protocols. So this is a process in evolution. In terms of the costs, to the best of my knowledge, we don't have a formal mechanism at present for people to pay for these PCR tests. Am I right, Dr. Charles? I'm correct?
With regard to the PCR test, we have not been charging persons landing on the airport and getting the PCR test.
Yeah, but we are in the process, and we have spent a lot of time over the last few days looking at mechanisms by which there could be some cost recovery, because it's the cost of the test, it's the cost of the manpower for the test, there's the cost for the security arrangements. So that certainly that will be written into people will have to, who are returning home, will have to undertake a measure of these costs, and they are probably by, I would figure, end of week, that should be confirmed exactly how that arrangement is going to go. So yes, there's work ongoing to because obviously the costs will mount as you get more and more commercial flights coming in. And for those who have skipped quarantine, I can't tell you the exact number. I don't know how many people have skipped quarantine. We know of one person who skipped quarantine. I believe has been contacted by authorities, and that's recently. How many others have, I don't know. But what I can assure the public is that we're going to try to do our level best to set up mechanisms. And of course, we get pushback. We get pushback from the individuals. Individuals desperately want to come home, but sometimes a few, not the majority, just a few, will push back a lot and find all kinds of reasons why they should not be quarantined once they get home. We are going to try to set up mechanisms that is going to make it to tighten the process even more than it has been already. If we had the app functioning, that would have helped a lot. But fortunately, at least we do have a few watches, and that can will help the process.
All right. So with regards to persons not obeying quarantine, what I would say is that we have had a number of persons who have committed breaches where quarantining is concerned, and we are in the process of taking the necessary legal steps against these individuals. In terms of rapid tests, we have done quite a number of rapid tests, but of course, remember, rapid tests are not used to diagnose COVID. That's why you will not see much importance placed on rapid tests as we do the PCR. Rapid tests are there to give you an idea as to whether someone has been exposed to the virus at sometime in the past. It could be recent past, or it could be distant past. I estimate we've done in excess of 8,000 rapid tests, or maybe more. In terms of pending PCR, the PCR tests that are pending right now are all of the persons who arrived from medium risk and high risk zones from Friday afternoon up till Sunday evening. I don't have the exact numbers, but all of the individuals who arrived from those countries on all of those flights, their samples are being processed at present, and maybe by later today we should have their results.
Thank you, gentlemen. Linda, that's for the time being.
Can you just clarify for me? Dr. Sean said a number of persons have breached. Can you explain the breach? Did they leave the quarantine facility? Did they not stay home? What type of breach was done? And the pending results from the persons who would have come in, you said, from Friday, today would have make it almost 72 hours for these people. Are these people presently in quarantine, or they have already left?
All right. When we talk about breaching quarantine, it means the persons have exited the quarantine location without authorization by a public health official. In terms of the testing, so on weekends we have a slight let's say difficulty or challenge because we do not do testing over the weekends. All right, persons who come into Grenada Friday afternoon, Friday evening, Saturday, Sunday, these persons inevitably must remain in quarantine for a longer period of time until we can get their results on Monday. All right, so they are not released until we get a negative results for them once the samples are processed on Monday.
Thank you. So we move on to Christelina. Good afternoon. And then Mikey, we come to you. Christelina?
Are you hearing me?
Yes, we are. Go right ahead.
Okay, good afternoon. I have a few questions, all kind of related. Now, Dr. Bradford must have elaborated quite a lot on the monitors that we do have, but I did not hear his presentation quite clearly. It did not come over quite clearly. So it's in relation to the watches or the monitors, if I might call it that, that you spoke of. Now, my question in that regard would be, would this come at an extra cost to the individuals that would be placed in quarantine? Or would it be government's property, or that person be, say, they would hold this as their personal property?
Christelina, just a second, please. You have can you turn on your volume, please, if it's up? Because you sound a bit distorted. There's a sort of background noise. Turn down your volume, please. Thank you. And then you can go right ahead.
Okay. Am I coming over better?
Well, there's a noise. Go ahead.
Wow. I don't know what else that I can do here to better that.
Go ahead. Go ahead.
Okay. Okay, so my question rests with the well, it rests with the watches or the monitors that Dr. Brathwaite spoke of. My question was that does this come at an extra cost to people going into quarantine? And are these monitors government's private property? Who would be putting on those watches? Would it be government? Would it be something that people can remove easily? I would like a little more explanation on these, please. And where are these being sourced from?
Right. The watches are not the property of government. It's a private entity that has purchased these watches, and they are going to be responsible for fixing the watches. Once the watches are fixed, then they will await the guidance from the Ministry of Health as to when the person is out of quarantine to remove the watches. The cost will be a measure. The cost will have to be borne by the individuals wearing the watch. But let me point out that it would be far cheaper for individuals to put on the watch and go home than to stay in the quarantine facility, because the cheapest quarantine facility, I believe, is about $100 a day, and the watch is going to come far cheaper than $100. So hopefully people would avail themselves of that possibility and put on the watch, and they will go home and they will stay in their home Not everyone might be able to go to their homes, because if they have elderly people in their house with serious underlying problems, that might prevent us, and the facility wasn't good, the home wasn't good enough. Health would have to make a judgment as to whether they could go to their home or not. But this is a mechanism by which individuals can save some money and at the same time be still kept in a relatively safe environment. At least you just restricted then, hopefully, to individuals who are living within your home circumstance. Because when you go home, I should point out, no one should be visiting you. So if you're going home and people come in visiting you because you just come back from New York or Miami or Toronto, that is defeating the purpose, right? Because of course we would not know that. We only know if you move out from home. So that is why we're alerting the public that individuals are going to be wearing these watches. So if you happen to go up and you see someone and you see them wearing this watch, ask a question. And if they just came from a high-risk area, say a pleasant good afternoon or good morning and leave, right? If you want to stay safe, that is our advice to you.
Any other from you, Christelina?
Yes, I have another. I don't know again if Dr. Brathwaite said it, but pardon me if I ask a question that you already covered. Are there any presently on island, and are there persons using those watches at the moment?
No, I know the company that has them, the individuals. I've seen the individuals wearing them, so they may be, when people see them, they may wonder, but they were wearing them as tests to check as they move from area to area if it was triggering an alarm. But to the best of my knowledge, no. But you know, these are things that are available on the open market, so I can't say definitely not. But from the point of view of this exercise, only one company that suggested to us that they provide this facility, and government has okayed it.
Okay, let's move on to Mikey. Good afternoon.
Hi, good afternoon to your panel. Now, my first question relates to persons coming into Grenada. Now, at what point are the persons coming into Grenada required to show proof of booking at a state-approved facility? Is it upon arrival at the airport or from the point of origin?
All right, so there are two things here. So for the chartered flights, those are a more controlled environment, and persons are required to have their proof of booking arranged first before they they're giving permission to board the chartered flights. Now, we presently are receiving commercial flights from the region and most recently from Canada. And with the commercial flights, it's a little more challenging because it's simply someone going and purchasing a ticket and landing here. So those individuals, upon presentation at our airport, are required to show that that the evidence of their booking.
What I would add to that is that we're trying to move towards a point where, indeed, in fact, it's not all formalized yet, but there's a lot of thinking going into it at present, where someone coming in would actually have to get some certification so that we would know, even if you're going on a commercial airline, that you're coming. Obviously, if you're coming from a green zone, you would not have to get a low risk zone, you would not have to get this certification. But if you're coming from a medium risk zone or high risk zone, you would have to get this certification. But this is a work in progress as we try to hammer out, because there are a number of issues that present themselves, and these things have to be discussed at length with tourism. It's not just a health issue. There are other implications there. But we're trying to see if we can push things in that direction.
Do you have another question, Mikey?
Yes, I do. Just as a follow-up this one, what happens if somebody presents at the airport without any documentation of booking, and they say to you, well, I do not have money? What happens then?
Well, what happens is we firstly try and ask the individual if they can make any booking, if they can seek assistance with booking a location as such. If the person really isn't in a position to book a location, then we will place them at a facility that we have control over. However, we do have to let them know that the facility offers very, very basic amenities. All right? So they would have to provide their own meals, and of course they would have to provide for most of their needs while they are at this facility. So in the first instance, we ask persons as to try their best to try and arrange a booking. If not, then we have no choice. We place them at this facility.
Okay. For this one, if you permit me to ask one more question. Has the Ministry of Health adjusted its operations in any way in response to the days celebrated last week, at least in an effort to detect whether or not there has been any form of transmission?
All right, so the Ministry of Health conducts routine surveillance of all diseases that occur in Grenada. All right, we have a surveillance system that operates 24/7 all days of the year. All right, we monitor both communicable or infectious diseases and chronic diseases. We have data on the trends in respiratory diseases, in gastrointestinal diseases for over a number of years. So this method allows us to detect any alteration in what the normal levels of disease that occur at any point in time are. And we produce an epidemiological report that we circulate to our stakeholders every week. This process continues. All right, this process continues. But in addition, as Dr. Brackett was alluding to, if there are individuals who know that during the past week and a half, they have engaged in activities that exposed themselves to the risk of acquiring COVID, they should make themselves, identify themselves to public health officials. Because, as I say, they're not only a danger to themselves, but they're a danger to everyone who comes in contact with them. So this is just an additional layer that we are putting on.
And just let me say a little quick response in addition to that. You know, I've come across individuals who tell me, and they seem to say it in all seriousness, I can't get COVID. I fit and I strong. The joke you're making. COVID has taken them. Strong, fit, young, every age group it has taken them. So just be aware of that, folks.
Okay, colleagues, we're approaching the 1 hour mark, but Linda Stricker, you have a couple more questions, so we'll have to wrap this up very soon. Linda?
Okay, are you hearing me?
Yes, go right ahead.
Right. Dr. Sean mentioned about the waiver for the public form. This form, one of the forms that I have to sign is a waiver. Can you explain that some more to us, what that waiver form is about? And with regard to the persons who would have breached quarantine, did they breach after getting a negative result, or they breach before getting the result?
With regard to the waiver, I would prefer to send you a copy of the waiver so that you can see it, because at present I cannot tell you what the wording of that waiver is. With regards to quarantine, we've had individuals who have committed the breach even without getting the results, even without being tested. All right, so this is why we are constantly encouraging persons that you need to continue observing all of the safety measures, because there are individuals out there who will put their wants ahead of your safety, and you might end up being the person who suffers the consequences of that individual's misguided choice.
Any other, Linda?
As a follow-up, did this person come from medium risk or high risk countries? And with regard to travel, how do you, what's the process of identifying someone who would have interconnect out of Barbados or Antigua? Someone who probably would have left the US, get a flight to Barbados and decide to travel on to Grenada. What kind of arrangement do we have with immigration authorities to ensure that that person is not providing false or misleading information to the authorities here upon arrival?
All right, so we've had individuals from both medium and high risk. Now, with regards to persons who transit, now of course there is a immigration form that must be filled, and you must declare at the back that the information that you provide is correct. This declaration is what is given to the immigration in Grenada. One of the lines is countries visited within the past 6 weeks. So if someone comes in and they do not correctly declare the countries where they have been that they have traveled to, in an attempt to evade the public health screening process, that person can be, it is possible that that person may be charged on different grounds. One might be making a false declaration to immigration officials, but in addition, when you are found, you've also breached the quarantine laws. So that person is really exposing themselves to all of these legal consequences just to avoid measures that are in place to protect the public from disease, which is something that should be unheard of.
Colleagues, anybody else before we wrap this up?
Well, I do have another question.
Okay, go right ahead.
And that has to do with people who are coming in. Now, we often hear the argument of people saying, okay, if I present a negative PCR test upon arrival that I took, say, 2-3 days prior to me traveling, why do I need to be quarantined mandatorily? Can you explain why this is necessary?
Yes, because the point, when you, just after you are only tested up to the point at which you have had the test. And indeed, in fact, even the day that you had the test, you could have been exposed a few days before, and the virus takes a bit of time to be able to show up. So you have even a few days before you actually had to take the test, and then you had the days in the interim before you got here. And on top of that, you're going to airports are high-risk areas for transmission of respiratory infections. You're passing on planes. Again, yes, they say that the plane air is clean, but we have seen cases of transmission, probable transmission through air traffic, through air travel. So you have a number of reasons why you need to have a further test, and we cannot be comfortable until at least 10 days minimum, certainly for medium risk areas, have elapsed since you've been here in an environment where we hope that there's no transmission of the virus presently.
That's it, Mikey?
Yes, for now.
I agree. All right, so we'll wrap this up now. As I've said, we passed the 1 hour mark. So, gentlemen, I'll give you the opportunity to say a few parting words.
Well, I would just like to continue to encourage the public to obey the COVID-19 prevention measures. All right. Sometimes we make decisions for temporary gratification that can have permanent consequences. We just want to encourage everyone to continue to follow the instructions. Wash your hands or use hand sanitizer. Wash your hands with soap and water, or use hand sanitizer if soap and water is not immediately available. Exercise good respiratory etiquette. All right, cough into the cuff of your sleeve or into a tissue and dispose of it in a bin with a lid when you need to. Avoid crowded situations. All right. Try and protect the persons that are around you. Even if you believe that you might survive or you're strong, the next person that is important to you might not be so lucky. So we just want to encourage everyone to try and practice the safety measures. Try and ensure that we are all safe and that Grenada does not have the experiences of many of the countries that are right around us, because it is the information is there. It is plain to see what this virus is doing in other settings, and we should not think that we are so lucky that it can never happen here.
Just before you go, Dr. Buffett, Dr. Charles, we just need to clarify something. Earlier on, you had mentioned that we don't do tests on weekends. Is that what you said? We need to clarify that, because there's a little bit of, a little gray area there. Some people are asking what exactly is meant, so you need to explain that properly.
Right. So one of the challenges that we have at our lab is manpower, and the present manpower does not allow us to conduct PCR testing on weekends. It is unfortunate that one of the persons who died in that unfortunate accident over the weekend was one of the persons that was involved in PCR testing. The accident, that vehicular accident recently on the St. David's Highway. All right. So the present manpower that we have does not allow us to do PCR testing on the weekend. It's an intensive process. So we do PCR testing Monday to Friday. So persons who land on Friday afternoon, they would have to wait in quarantine until Monday before they get their results. And the results are usually ready by the evening.
Thank you, Dr. Bradford.
Yeah, just advise the public that we're in a situation with a global pandemic. Do not consider that the virus, yes, we have no evidence at this point of transmission, but we have to consider ourselves, as one of my colleagues said, as being COVID susceptible. Recognize that the individuals who are getting the virus, in some instances, their antibodies are what protects them against getting the virus back. These antibodies are waning quickly. The studies aren't clear on that, but it could be suggesting that if you've had it before, you might be at risk of getting it again. We have to hope that we can find that the world finds a successful vaccine that at least helps us ameliorate the problem to some extent. In the meanwhile, the many things that have been preached over the weeks and months, adhere to them. Wear your mask, wear your mask, wear your mask. Keep your distance. Keep up good hygiene. Stay safe.
Thank you so very much, gentlemen. And to all of you viewing on Channel 22 on our Facebook page, and of course our colleagues, we do thank you so much for being with us. We have had with us Dr. Bradford, the chairperson of the Health COVID Committee. He just finished speaking. And before him, we had the Acting Chief Medical Officer, Dr. Sean Charles, wrapping up his piece. So we do thank you so much for being with us. Ladies and gentlemen, have a pleasant afternoon.
Thank you.
Stay up to date with all that's happening with the new national party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.